Everyone, my name is Dr. Vallabh Chawla, and today we'll be doing a case report on root stripping as seen in mandibular first molar teeth. Okay, so also we'll be seeing a case of crack line in the same tooth of concern. Patient so basically came with a chief complaint of pain in the lower left side. Okay, so we could find some findings in the CBCT scan. So we took a sectional CBCT of the lower left side. The tooth of concern was 3-6. Okay, so this is the axial view, this is the coronal view, and this is the sagittal view. Coming to the mesial root, so this is the mesial root, and this is the MB canal. As we can see, this is the MB canal. This is the MB canal, which is filled till the apical 1/3 region. It is entirely filled, but still periapical pathosis is evident. And this is the mesiolingual canal as seen in the coronal section. This is the mesiolingual canal, and same mesiolingual you can see it in the sagittal section, and the distal canal, which is seen in all the three cross sections. You can just see this is the distal canal. Periapical pathosis again evident. This is the distal canal as seen in the coronal cross section. Okay, so there is a nerve canal cortex that is passing by, and we can see that pathosis is in close relation with the nerve canal cortex, and also you can see some kind of contact of pathology with the inferior alveolar nerve canal cortex, and it has caused bit erosion of superior cortex of the inferior alveolar nerve canal. Okay, so some findings that were seen, you can just see the findings in the mesiobuccal root canal. You can see this is the mesiobuccal root canal. Okay, so here we'll get this thing to the mesiobuccal root. Okay, so you can just see this thing now. Just appreciate in the sagittal cross section. Okay, you can see some kind of lateral perforation, or also known as stripping. This could be due to over-instrumentation, and one of the most common symptoms during root canal is presence of hemorrhage, that is radiolucency, seen in the IOP or RBG, or as seen in the CBCT. So this is one of the findings. Also, the radiolucency is also evident because one of the crack line that is seen in the furcation region. So you can see how this border is maintained, the tooth border is maintained, but because of the lateral perforation here, you can see some kind of like osteoclastic activity. Similarly, you can see it in the axial cross section. You can see this border of tooth needs to be maintained, but due to over instrumentation, you can see the gutta percha is in close relation to the furcation region, and hence this could be one of the reason. Also, you can see like how one of the reason why distal root also has radiolucency, not because of the root stripping, but you can see this is the distobuccal root canal as seen. So there is a distobuccal root canal, but also there is evidence of faint appearance of radiolucency, as you can see it in this region. Okay, this thing needs also may require filling, so we'll just get this thing over here and arrange it along the long axis of the tooth. You can see this thing over here, this radiolucency. So it needs clinical evaluation and chest side investigations to check if it requires filling or not, because the radiolucency is evident. It could also be suggestive of either a canal or a dead space like appearance. Now coming to the another finding that is seen is the crack line appearance, which is very well evident in the axial cross section. Okay, from occlusal aspect, we'll just go down and have a look. Okay, we'll just this is scroll down, scroll down, scroll down, scroll down, and this is the mesial root. In the mesial root, you can see the evidence of radiolucency over here. Okay, this thing is suggestive of crack line. It appears as faint linear line, and similarly it can be appreciated over here in the sagittal coronal cross section. This is one of the crack line, and here it just gives an appearance of a small radiolucent dot or line. Okay, so this was about crack line number one. Also, patient has uh, furcation bone radiolucency. So we could just see some kind of finding in the furcation region, the radiolucency that is seen. So can make it out over here in this sagittal cross section, this radiolucency that is seen. This could also be evidence of one of the crack line as seen. We'll just hide the lines. So this dot that you can see, micro dot which is there, so that is one of the evidence of crack line. Okay, we'll just pause this video. Yeah, coming back to the video, so as you can see, this is the crack line, and now similarly you can see the radiolucency over here in the sagittal section. So The radiolucency that is there in the distal root is because of the extra canal, either extra canal or the radiolucent space, dead space. This furcation radiolucency, either it could be because of the root stripping that is evident in the mesial root, mesiobuccal root, or it could also be because of some kind of crack that is noted in the furcation region. And the radiolucency that is there in the furcation region is because of one of the radiolucency over here. Okay, so we can also study this in smallest cross sections, and we can just have a look at it. There's a mesial root, furcation region, and the distal root, and how the pathology is in very close relation to the nerve canal cortex. Okay, so in the mesial root you can also appreciate the pathology that is in contact with the inferior alveolar nerve canal cortex. So this was everything about the root perforation, or sorry, root lateral perforation, which is also known as root stripping, or also about the crack line appearance as seen in the CBCT section. Thank you so much.